In this video, I answer a question on whether doing traditional physical therapy, specifically exercises and stretches, is going to help fix a chronic shoulder injury. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on why I make these videos. I don't make them to entertain, but specifically for anyone who has been dealing with chronic neck, shoulder, elbow, or wrist pain for at least 6 months. They've tried just about every type of treatment. They've been lied to, overpromised, and underdelivered by the current medical model, really in hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. All right, so this week's question came from Jill on LinkedIn. Let's read it. It says, I am on week 6 of physical therapy for a chronic shoulder problem that I've been trying to get fixed for the past 2 years. My diagnosis was shoulder bursitis caused by an impingement of the joint. The PT told me the range of motion was limited in the muscles of the rotator cuff, and the muscles were very weak as well. We have been focusing on building up strength back into the rotator cuff during the sessions, and then they gave me some stretches to do in between visits. Overall, not much has changed pain-wise for me, and some of the exercises can make it worse. The stretches seem to help it feel loose for a few hours, but nothing lasting. The PT tells me to be patient and that this problem didn't happen overnight, which I get, but I'm going on my 14th visit and just making sure that I'm not wasting my time and on the right path. Do you think this PT is going to help, or should I try to find something else to do? Thank you so much for sending that in, Jill. And just a quick reminder, if you do have any questions you want me to cover specifically on neck, shoulder, elbow, or wrist pain, send them in. And if I think I can help, I'll make a video and get it out to you. All the information to do that is available wherever you're consuming this. Let's get into the video. What am I going to cover in the video? First is, why is physical therapy, for context, I'm going to say traditional physical therapy. This is really, I'm talking about just doing exercises and stretches. I understand there's lots of physical therapists out there that are doing really good work. They do a lot of manual treatment as well, which I am a big proponent of, but I'm talking about like a strict, one of those, I call them like PT mills, that are covered by insurance, where they're just kind of, checking some boxes and going off from there. I'm going to cover why are they usually the first treatment prescribed and mostly covered by insurance. Next is the most common and most missed cause of decreased flexibility, weakness, and pain. And lastly, the importance of following an exact process in trying to fix the injury, and how to determine if the treatment you're doing is actually helping. So why is physical therapy usually the first treatment prescribed and mostly covered by insurance? Once again, I'm talking about traditional PT. A lot of people will come at me and be like, I don't know what I'm talking about, and get upset. I'm not talking about all PTs. I'm talking about traditional PT, exercises and just stretches, no manual work, no other stuff, just the basics, what they learned in school, and nothing else. Usually it's pretty cost effective. There's not a lot of money involved in delivering physical therapy. There's not surgeries or drugs or medications or anything like that. So it's pretty cost effective, and they don't need a lot of tools and machines and different things to do it. They can just get in there and do it. So it is pretty cost effective. It's also the most researched. I put that in quotes because most of the research out there for musculoskeletal injuries usually is done in some type of physical therapy setting. And a lot of times they do these research studies with students that are like, in their 3rd or 4th year in their studies in college. And a lot of times they're not usually the best of the best, but it's a good place to have like a control and have a study go. So it is the most researched out there of all the other type of treatment modalities. Like I'm really considering conservative stuff like chiropractic and massage and things like that. But PT is definitely the most researched. Next is, it's just a hoop for the patient to jump through. Really, I think, especially when we're talking traditional PT, through to get frustrated and then deny and delay advanced treatments. Anytime you go somewhere, maybe you go to the primary care doctor and you want to get an x-ray or an MRI, they're like, well, you got to go do 6 weeks of PT first. That's what the insurance requires. They're really doing it just to kind of frustrate you and hope that you'll like just not follow through, because a lot of the insurance companies don't want to pay for more advanced imaging like MRIs and stuff like that. And then they also don't want to pay for like medications and injections, even though I think all that stuff is really bad for you. But, you know, a lot of people think that's what's going to fix it. So they make it like hoops and stuff you got to jump through. And they're really just trying to, the thing about insurance companies is they don't want you to actually use your insurance because then they have to get into their profits and their money. They just want you to pay your dividends and your premiums and then just hope that you don't actually use it. That's their whole business model. Next is it's just low risk of any complications. Like I said, they're not doing surgeries or medications or cutting you open. So the chances of actually having like an adverse reaction from it is very, very low. So that's why physical therapy is the first treatment prescribed and mostly covered by insurance. Pretty much every single basic insurance plan has some form of physical therapy component in there. It's definitely the most widely used when it comes to starting with a musculoskeletal injury. Next is, what is the most common cause of decreased flexibility, pain, and weakness? I talk about this all the time. It's this stuff called adhesion. Basically, adhesion is like glue that gets inside the muscle, also known as scar tissue. And over time, with bad postures, lack of movement, stress, staring at your phone all day long, sitting at a computer, your muscles get stretched, overused. They don't get enough blood flow and oxygen. And then they start to develop this stuff called adhesion and scar tissue. When it gets in there, first, it makes the area less flexible. Then it makes it weaker. And a lot of people think, oh, when it's tight or doesn't feel right, we should stretch it. But the problem is, in order to actually break down this adhesion, it needs not just tension, but it needs depth. It needs just the right amount of depth and just the right amount of tension delivered by a skillful manual therapist that knows how to get in there and find and fix it. I say a lot of times, think of this as like a cavity in your teeth that needs to be like drilled out, precise and focused. And a lot of things like stretching or even like traditional massage or exercises, they're really like trying to brush and floss. Good for the teeth in the beginning, but if you're trying to fix a cavity with that, it's actually going to be counterproductive. Then what happens over time is that adhesion gets bigger and bigger and spreads out through the muscle. Eventually, it gets stuck to the nerve and forms what is called a nerve entrapment. So nerves are built with about 15% of like extra slack to make their way through the muscles and out through the body. Over time, eventually what happens is that adhesion just gets bigger and bigger, and then it gets stuck to the nerve. When it happens, first it starts with some numbness and some aching and some burning and then some tension. Then you might also see some postural changes in there where if like the nerve is stuck, the shoulder might roll forward, the trap might go up, all sorts of different things you might see in there. And when this happens, the body's number one priority is to protect the area, because if the nervous system gets compromised, it can cause a lot of issues and can put you in a bad spot. It can cause a lot of issues across the board. So a lot of times it'll change things with your posture, your movement, everything, and try to get you to not load that area because it does not want the nerve to get compromised. So next is the importance of understanding why something is tight or weak. So I always ask the question where someone's like, oh, the muscle's tight, just stretch it. My question is like, well, why is it tight? And sometimes that might be because that adhesion's there. Another time might be because that nerve entrapment's there. Maybe there's some damage to the joint, the cartilage, or the disc. So understanding why it's tight is really important, because if you just go, oh, my muscles are tight and I need to stretch, it might not be the right treatment. It can actually make it a lot worse. So we always want to know why it's tight as well, so then we can apply the correct treatment. And don't just default, like I said, to just stretch it. They're like, oh, my muscles are tight, I just need to stretch more. Maybe, but if this is a chronic problem that's going on for a long time, the chances of you having a significant amount of adhesion, nerve entrapments built up is very, very high. Next question is, why is it weak? And I said, as that adhesion forms, first it makes the area less flexible, then it makes it weaker. That force can't generate anymore, so the muscle becomes unhealthy. So once again, a lot of people, especially traditional physical therapists, go to this idea of, well, it's weak, so we need to strengthen it. But my question again is, why is it weak? It's weak because these other things are there. So if you try to put more load and more force into the area of a muscle that's already damaged and unhealthy, you could actually make it a lot worse. So just jumping right into an exercise without understanding why it's weak can actually be counterproductive and sometimes dangerous. That's why we want to stay away from defaulting to just strengthen it. Next, the importance of following an exact process to help fix an injury. There's an order of operations to fixing any problem. First thing we need to do is we need to restore the range of motion. That's basically getting it healthy, getting it moving better, getting to a provider that specializes in manual treatment that can get in there and find and fix the adhesion. they get proper depth, they get proper tension, they have you go through a full range of motion. And that pressure and that friction is what breaks down that adhesion, breaks down that nerve entrapment so the muscle's healthier and it starts flexing and moving better. Then we need to balance the strength. So once we get all that gunk and junk out of the muscle, then we actually need to build up some strength again because it has been weak. That's where like corrective exercises come in, like really more focus on just one particular muscle or one range of motion is really important. Once we build the strength back up in there, then we need to increase the strength. That's with global movements, like getting into like different movements, like in the shoulder, in the chain, maybe in the hip, in the low back, and getting it moving as a unit together after we piece it together from there. And the best thing is physical therapy, even traditional physical therapy, they're great for number 2 and 3. That's what they do. They're the best at doing that. I have great relationships with local physical therapists in my clinic that I refer out to once I clean up the tissue. But the thing is, if you're trying to get the muscle more flexible and then put strength on it before it's actually healthy, it's going to be counterproductive. So the first person you need to see is a advanced soft tissue provider that can get in there and clean up all that stuff, then go to physical therapy and do this. It's just backwards the way the system is set up and how we do it. Next is, how do you determine if the treatment is going to help fix the problem? One thing is you always want to make sure that there are tests and measurements that are functional. And you're not just focused on symptoms, because symptoms can kind of be up and down throughout the process. So you want to get to a provider that has measurements and tests. So in my clinic and all the people that I train in my system, the PEAK method, everything has like measurements and tests to know we're making improvement, because as we get it functioning better, it will start to feel better, but we got to get it functioning better first. And if we're just only focusing on the symptoms, we're not getting to the root cause, because a lot of times the symptoms are more of the effect, but not the true cause. Next thing I have what's called a 5-visit rule. And I think every provider should have this, but unfortunately it does not get followed in the current medical model. Basically for me is we should see a significant improvement in range of motion and function in the first 5 visits. If we're not seeing that, then this isn't the type of treatment you need. Maybe something was missed in the diagnosis, maybe something else is going on, but it's not the right type of treatment. So if you're on like visit 20 with anybody and there's no measurements, there's no test, no way to really know if you're doing better, and all they ask you is how you feel, they're not going to be able to fix your problem, and you should just get the heck out of there and move on to somebody else, because all you're doing is wasting your time and your money. And lastly, this one might hurt to hear, but it is the truth. Usually it's not covered by insurance. Funny when you say that, right? It sucks because we all pay a lot for our insurance and we want to be able to use it. But the problem is things that actually work and fix problems, insurance companies do not like to pay for. And a lot of times if you're picking a provider solely if they're in network with your insurance for your injury treatment, a lot of times that provider isn't going to be as good, because they're basically getting told what to do by the insurance company, how to treat, what to treat, when to treat. They're calling the shots, not the doctor themselves. So your best bet is to actually look for out of network and go to someone that doesn't participate in insurance, because they're going to be able to focus on your treatment much better. They're not going to have a waiting room full of people. They're not going to have to fill out a million forms and try to figure it all out and play the games of the insurance company. They get to focus on you, the client or the patient, and they get to get you better and provide the best results. So where to go if you need help, chronic pain, not getting any better? Click the link in our profile to learn more about our new injury treatment process that provides long-lasting pain relief and better flexibility for chronic neck, shoulder, elbow, and wrist injuries naturally without the use of medications, injections, or surgeries. And all the information to do that is included in the description or wherever you're watching this video. I appreciate you watching, and we'll see you on the next one.